This solution is prescribed to help treat specific types of cancers, such as pheochromocytoma and paraganglioma. Iobenguane Iodine-131 Solution is a type of radioactive medication that targets and accumulates in the cancer cells, ultimately leading to their destruction. It is important to follow the recommended dosage and timing for maximum effectiveness. Always consult with your healthcare provider for the best time to take this medication and the benefits it can provide for your specific condition. When using Iobenguane Iodine-131 Solution, it is administered through an injection into a vein by a healthcare professional. Your doctor will determine the dosage based on your medical condition, weight, lab tests, and response to treatment. Typically, it is given in 2 doses, at least 90 days apart. To reduce the risk of side effects, your doctor may prescribe other medications to prevent nausea before each injection. Additionally, a drug will be prescribed to protect your thyroid gland, starting 24 hours before and continuing for 10 days after each dose. To minimize damage to your bladder, it is recommended to drink at least 8 glasses, 68 ounces/2 liters, of liquid daily, starting at least 1 day before and continuing for 1 week after each dose. It is important to carefully follow all of your doctor's instructions. Some common side effects of Iobenguane Iodine-131 Solution include dizziness, tiredness, headache, nausea, vomiting, diarrhea/constipation, abdominal pain, change in how food tastes, dry mouth, throat pain, or loss of appetite. Your doctor may prescribe medication to help with nausea and vomiting. Eating small meals, limiting activity, or not eating before treatment may also help with these effects. If you experience severe side effects or if they worsen, contact your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. If you experience dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. Temporary hair loss may occur, but normal hair growth should return after treatment has ended. This medication may also raise your blood pressure, so it's important to monitor it regularly and inform your doctor if the results are high. Be sure to tell your doctor right away if you notice any serious side effects, such as easy bruising/bleeding, signs of kidney damage, or signs of infection. While serious allergic reactions are rare, seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. Before taking Iobenguane I-131, make sure to tell your doctor if you have any allergies or if you have a history of kidney problems, thyroid disease, or high blood pressure. This medication may increase your risk of infections, so it's important to avoid contact with people who are sick. Let your healthcare professional know if you need any vaccinations, and be cautious with sharp objects and contact sports while taking this medication. It's also important to avoid alcohol and marijuana, as they can make you feel more dizzy. This medication may also increase your risk for other cancers, so be sure to talk to your doctor about any concerns. If you are pregnant or planning to become pregnant, it's important to discuss reliable forms of birth control with your doctor, as this medication can harm an unborn baby. Breastfeeding is not recommended while using this medication and for 80 days after the last dose. Always consult your doctor before breastfeeding while taking Iobenguane I-131. When taking Iobenguane Iodine-131 Solution, it's important to be aware of potential drug interactions. These interactions can affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products. Share this list with your doctor and pharmacist to ensure that they have a comprehensive understanding of your medication regimen. Do not start, stop, or change the dosage of any medicines without first consulting your doctor for their approval. This will help to ensure the safe and effective use of Iobenguane Iodine-131 Solution. If someone has taken too much Iobenguane Iodine-131 Solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while Canadian residents can reach out to their provincial poison control center for assistance. It's crucial to act quickly in these situations to ensure the person gets the necessary help. It is important to have lab and medical tests done, such as complete blood count, kidney and thyroid function tests, and blood pressure monitoring while using Iobenguane Iodine-131 solution. Make sure to keep all your medical and lab appointments. Make sure to take each dose of Iobenguane Iodine-131 solution as prescribed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. It's important not to take a double dose to make up for a missed one. This medication is administered by healthcare professionals in a hospital, clinic, or doctor's office and is not meant to be kept at home. It is used to treat certain types of adrenal gland tumors and neuroendocrine tumors. The dosage and timing of the treatment will be determined by your healthcare provider. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.